afternoon, everybody. I'm Martin Elliott. I'm going to be chairing today's session. So thanks for joining us today for this Exchange Wales webinar on nearest relative resources in the context of mental health systems. We're really lucky today to be joined by Professor Judy Lang, Dr. Kev Stone, and Jeremy Dixon. This is the first webinar in our current conference series on informal care across the life course, with 3 other webinars over the next 2 weeks and 2 podcasts. Please visit the conference page where you can watch our conference launch video, and we'll also put a link in the chat to the other sessions that we're due to be covering over the next couple of weeks. By its nature, this webinar will cover sensitive issues around mental health, which some people might find upsetting. We aim to provide a supportive learning environment, so please be mindful of your own well-being and that of other participants. If you've any questions for the presenters, you'll need to do that through the Q&A function that you'll see at the top of your bar. So if you can put questions in the Q&A box. If you want to chat between other attendees and yourself, or share best practice examples, or just general networking, you can use the chat box for that. The presenters have kindly given their permission to share their slides afterwards, so we'll send those to you by email with a link to the recording once that's available. The presentation is going to be about 40 minutes, and once that's concluded, I will ask the questions that are put into the Q&A box. So at this point, I'll hand over to our presenters, and I'm looking forward to listening to it. Thanks very much.
So thank you very much, Marty. My name's Jeremy Dixon. I'm a reader at Cardiff University based in the Centre for Adult Social Care Research. And I'm joined by my colleagues today, Professor Judy Lang from the University of Bristol Law School, and Dr. Kevin Stone from the University of South Wales. So I'll be kicking off the first part of this presentation and then handing over to Judy and Kev. So the things that we're going to focus on today are the legal context. So we're going to explain a little bit about the Mental Health Act. So I'm aware to some of the people here, you might be working in mental health, and this might be quite basic to you, but for other people, some people may not have a good understanding of that, so I'll just give an overview. We're going to talk about some research that we conducted on the nearest relative experiences of the Mental Health Act, and we'll then move on to talk about an online resources project that we have done, which Judy has led with the rest of us involved, focused on providing information for nearest relative. And Kev is going to talk a bit more then towards the end about changes to the Mental Health Act, which are due to occur in the next couple of years, we think, although that's still being decided by government at the moment, but we can give you a heads up about the changes that are likely to occur. So first of all, we just want to give a little bit of information about the legal context. So the Mental Health Act 1983 is the law in England and Wales. It allows for people who are seen to have what the Act calls a mental disorder to be detained in hospital for compulsory admission and for compulsory treatment where particular conditions are met. Usually the admission process in the community would be that an approved mental health professional, who's normally a social worker, would organise a Mental Health Act assessment, which would be attended by 2 doctors who would provide medical recommendations. So if all 3 of those people agree that somebody needs to be detained, then a detention can take place. So professionals tend to understand the Mental Health Act quite well because it's part of their everyday life. But carers have a particular role in Mental Health Act assessment. So the Mental Health Act provides for what they call nearest relatives, and the role of nearest relatives is set out in the Act, and it dates quite a long way back. So it dates back to something called the Percy Commission, which occurred in 1957, and in the run-up to the 1959 Mental Health Act, this committee was looking at the issue of how relatives ought to be involved, and it felt, well, relatives are often the first people to notice signs and symptoms of mental illness, and they felt, therefore, relatives should have a role in the detention process. So it's seen as being important to protecting the rights of people who may be detained within hospital, and protecting their human rights, particularly their rights to liberty under Article 5 of the Human Rights Act. And these rights also need to be balanced against other rights in that act, such as respect for private and family life. So it's not necessarily straightforward, but the nearest relative is there to try and protect the rights of the person and also to act as their advocate. So they have a number of different powers, which sometimes seem to be pointing in different directions. So they can request an assessment under the Mental Health Act from an approved mental health professional. They can apply for an admission under the Mental Health Act, although in practice that very rarely happens. They can object to an admission for treatment under Section 3 of the Mental Health Act, and they can also order the discharge of the person. So who is a nearest relative? So one of the key things that's come up in government's recent reviews of the Mental Health Act is that at the moment, who your nearest relative is defined by law. So it's set out in Section 26 of the Mental Health Act. So the important thing to note here is that at the moment, if you are being assessed for detention, you don't have the ability to choose who you would like your nearest relative to be. Currently, it's set out in this kind of hierarchy, which is given in the Mental Health Act, and an approved mental health professional would need to identify who your nearest relative is based on this list. So the list we've given, it's slightly more complicated than this. So people who are carers get priority up the list, and also people who've been living with the person for more than 5 years may get priority. And then if there's two people who fall under the same categories, such as a son or daughter, for example, then the approved mental health professional will be looking for the older person of those two people. So the key issue here really is that it's been seen as an issue by legislators because patients themselves don't have choices, and often it can be a surprise to relatives as well, who think, well, why is it me and not somebody else, or vice versa? So there can be several challenges related to the role, which have been identified by commentators. So approved mental health professionals are the people who are identifying nearest relatives, but it can be difficult for them to work out who the right person is under this kind of list that I gave earlier on. If you are an approved mental health professional yourself, then you'll know that quite a lot of your training goes into, trying to train you to identify the right person, and also you would be given some training in how to have those types of conversations. But if you look at what nearest relatives themselves feel about the situation, previous research in the past has said that, well, they're often not necessarily aware of the rights and powers they have, but we found that this was really unclear, really, from previous research. So we wanted to do some research to look at what nearest relatives felt about their role, because there had been a bit of research in the past, but it was still pretty sketchy and didn't really take into account some of the current practice realities. And this issue was also raised as something which had been, which was seen as of interest to government, and was looked at by the Independent Review of the Mental Health Act, which was commissioned by Theresa May's government to review if mental health law change was needed. So Judy, Kev and I did some research papers looking at this issue, which I've given references to here. Most of them are free to see on the internet if you want to look in further detail. But we started off by looking at the history of the nearest relative role, and we questioned in that paper whether it was an effective safeguard and looked at some of the pros and cons of the law as it stood. We also did a piece of research with approved mental health professionals, looking at how they put the role into practice, and I'm going to kind of skip over that today. But we then did 2 other papers looking at how nearest relatives themselves understood and experienced the role. And 2 key things came out from that. First of all, people found the role quite difficult at an emotional level and quite burdensome. And they also identified problems understanding and applying the law. So I'm going to quickly skate through those findings before we then talk about what we did with the research in terms of providing resources for nearest relatives. So very quickly, in terms of the methods we used for the research, we carried out 19 semi-structured interviews. They were conducted by Kevin in 2018 and 19. Participants were recruited via approved mental health professional gatekeepers, so local authorities essentially, and 12 women and 7 men were recruited, aged between 34 and 72. So the questions focused on nearest relative experience. So we asked people what had led to their relative being detained under the Mental Health Act, whether they were aware of the concerns about the person's mental health beforehand, what they remembered about being contacted before and after the Mental Health Act assessment, and how they felt about being identified as the nearest relative and what their knowledge of the role was, and also their experience of the process. So as with most research studies, we gained ethical approval. For this study, it was through a university ethics committee. So there are several themes that came out. So the first one was about awareness and knowledge of the nearest relative role. So the Mental Health Act mandates approved mental health professionals to do certain things. So as I mentioned previously, they should inform the nearest relatives of their role and right to discharge a patient, and where people are being assessed for Section 3, which is for treatment, then they should ask the nearest relative whether they object to an admission taking place. So we found that people who were nearest relatives felt that they hadn't been given a huge amount of information about the role. So several participants said that it hadn't really come up for them. So this first participant says here, I don't remember hearing it. Probably the first time I saw it was when I received a letter stating that I was the nearest relative and when my mum was, and how long the section was in place for. So in this case, the person, couldn't remember being informed or consulted until quite late in the day. And then others said that they were told about the role, but they weren't really given a clear explanation of its significance or what it meant. So this participant here says, to be fair, when I first got told I was the nearest relative, I didn't have a clue what it meant really. And to some extent, nearest relatives thought that this was because people in general don't get very much mental health education. So this participant here says you don't learn about Mental Health Act in schools, you don't learn about that and what it means, and they don't really talk about human rights. But generally speaking, people said, well, we didn't get much of an explanation from mental health services about the role, what it meant, or what we should be doing. And there was only really one case where somebody gave an exception to this and felt that they had been well supported by services. So when we asked nearest relatives what they felt about the role, some people felt that it lacked status. So the first participant here says, I really do not think there's a lot of respect for it, the role. And when we've done the consultation with nearest relatives, they often made this point as well, and reflected that they can be in clinical meetings and quite often can be ignored or not really involved in care planning in some cases. And some people said that they had learnt that they needed to kind of advocate quite hard for the person. And this is in line with some legal theories about what's called legal capability. So this participant here says, I've learnt to sort of bang on about my own rights. But people also said, well, you know, some people might be more confident to carry out this kind of role than others. So some of the nearest relatives said things like, well, I don't really feel strong enough to carry out this role and to be a strong advocate for the person, for example. And linked to the last theme, people said that they didn't feel there was much support for nearest relatives. And this participant here says the whole experience was not very pleasant, really, and there has been no support. And people felt, well, it could be useful to get support from somebody sitting down with you for an hour from mental health services, or from somebody in the voluntary sector, you know, conducting a course to explain. So most people were aware that the Mental Health Act was being reviewed and was likely to change in the future, and they gave some views about what might take place under these reforms. So aligned to some of the previous points I've made, people felt that they should be given more time. So this participant here, number 10, says, I mean, my feeling is as soon as a child or adult gets admitted to mental health and you become the nearest relative, there should be an hour-long session with someone to sit down and explain to you what their role is. Some people felt that it'd be really helpful to have a particular support person for nearest relatives in a local authority or health authority. And people also said, well, what's not taken into account is how hard it is emotionally, and there should be some support from that point of view. So participant 1 here says, I feel they've got to realise that we're laymen, and they've got to realise that you're dealing with very vulnerable people like me first time. I think they forget that they deal with that all the time. So a common theme was that mental health professionals tended to assume that other people had the same level of knowledge as them, and from carers' perspectives, they found that quite problematic. So very briefly, I'm just going to run through these discussion points so I can hand over to the others. So a dominant finding was that people received poor or limited information about their rights. A new finding that we had from our research was that AMPs and other professionals tended to assume that nearest relatives had quite a high level of legal knowledge, which was disputed by nearest relatives themselves. And thirdly, nearest relatives felt that their role lacked status, and that seems to align with themes within other research as well. So I'm going to move over to Judy now, who's going to tell you a little bit more about how we set out to kind of tackle the problems which nearest relatives raised.
Thank you very much, Jeremy. I hope you don't mind moving the slides on for me, if that's all right, because I think you're sharing the screen. So thank you, Jeremy, for sort of starting off and framing that really well. And it's lovely to see so many of you on the call today in the webinar joining us during Carers Week. So we're delighted to be here. And because it's in Wales, I just wanted to take the opportunity to say Prynhawn da and Croeso, as I am fortunate enough to be a Welsh speaker, having grown up in North Wales. So it's lovely to join you today. So I'm just going to talk really about the second phase of the project that we've been working on together. So Jeremy's spoken very much about the sort of literature reviews, the desktop research and the empirical research we did. And I think one of the most dominant findings really was how ill-equipped, ill-informed and unsupported nearest relatives told us they felt. I mean, obviously, nearest relatives are a small part of a big body of carers, and in some cases, you know, they might not necessarily be directly involved in caring for their relative, but it was clear that there was a lot of misinformation and a lack of information. And so one of the gaps really was that we decided to fill was to see if we could actually try and develop a project to provide some reliable and trusted information. And we really wanted this to be driven from the ground up, based not on what we thought that relatives would like to know and need to know, but on what nearest relatives told us that they would like to know and what would be helpful. So what we decided to do was take this work forward in what's known as a kind of impact project, to think about how we can translate this into something workable on the ground. And we applied for some funding from UK Research and Innovation through the University of Bristol. And we were very fortunate to get a small pot of funding to bring people together in Bristol. We had an in-person workshop in 2024, and we were fortunate to have support from the Rethink Carers Service in Bristol and Mind as well, who helped us to recruit some nearest relatives who had experience of being in the role. And they came from a number of different backgrounds and had different relatives who'd been admitted. And we really wanted to draw on their experiences to help inform what we developed. And on the back of that initial workshop, which also involved people from the legal helpline at Mind, who are constantly responding to calls, as well as professionals and AMPs who work in this space, we put together a plan that would then help us to develop some online resources. And so that really was the next phase, was to apply for further funding to co-create really the online resources that we've put together, with the aim of providing reliable, trusted information about the law, about the role, how it fits with other roles, what the rights are. And I think one of the significant findings that came from our workshop was that the nearest relatives told us there is quite a lot of information out there already on the internet, but it's all separate. It's all in lots of different discrete pockets. And whilst it's useful information, it isn't necessarily always helpful in telling you what you should do. It tells you what you can do, but it doesn't always tell you what you should do and how you should go about doing it. So I think for us, one of the key parts of the information we developed was using tips and guidance from people who'd been in the role to help you to know how to exercise your rights. And I can just explain a little bit about how we do that in a minute. And I think significantly as well, responding to the point that Jeremy made about the need for emotional support, we have tried to recognise on the website, again, based on what people told us that was important to them, the need for self-care, how you look after yourself, what you might be able to do and where you might be able to go for support for yourself. Because whilst you are supporting somebody with mental illness and you're thrown into this very confusing and complex role, that takes its toll on you emotionally as well. And it's important to recognise that as part of the process. So we had these knowledge exchange events, as I've said. The second one was very much about firming up, putting flesh on the bones of what we would need for the online resources. And then we worked together over a period of time to develop the text, to develop a range of different tools. And that includes leaflets, fact sheets, as well as videos with tips and guidance. And I'll talk you through that a little bit in a minute. So we were very fortunate to have support as well from the Carers Trust, who held a national online launch event for us. And if you visit the website and have a look at the tools that we've developed and the guidance, you'll be able to access that online launch event where we spoke about the experience. And in particular, we invited two of the nearest relatives who were carers on the project to talk about their involvement and their experiences and, why they got involved with the project. So we launched it in 2025. And since then, we've been busy taking part in various engagement and dissemination events. We're trying to get feedback as well from various stakeholders about the resources, how useful they are. Is there anything that you'd like to see that's not on there? And we really very much welcome feedback and comments. So if anybody has had an opportunity to have a look at the resources in advance or during the call or afterwards, we'd very much appreciate if you can let us know what you think about them as well, and if there's anything that's missing. So really, this is about bringing all the information together in a trusted place online. We've also got a mobile friendly option, and what we're trying to do as well is to develop information that we can keep up to date, and we have a blog on the website, so we regularly put updates and things in there about the changes to the law. And what we're now working on is, I guess, the final stage of updating the resources. Jeremy already mentioned at the start that there are changes afoot to this nearest relative role that Kev's going to tell you about in a minute. And what we're very mindful of is the need to make sure that the resources we provide are reliable and are up to date. And so we are going to be reflecting that over the next 6 to 12 months by updating the website to make sure it has all the information that's necessary when new laws come into force with a new role to support carers and family members in the system. So do you mind just flipping along a bit to the next slide? So I've just got a few slides here really just to give you a bit of a flavour. So this is the welcome page for the website, and you can see up there that we have a welcome message. We also have sections that tell you how to use the resources, how to navigate your way around, where you might like to go for different parts of information. We've got a section which tells you what is the nearest relative, with a drop-down menu which gives you different bits of information about how the role works, what the powers mean, and how it links to other roles you have. And I think that came through very strongly in the workshops that we had, was the overlap that there may be with other roles that you might have. So particularly your role as a carer and the rights that are associated with that, but also in some cases you might be acting as a lasting power of attorney for your relative, and it's thinking about how those different roles overlap and how they are distinctive as well, and that's also important to clarify with the information on the website. We have another section which tells you about your rights, and then various other sections that tell you a little bit more about how to find more information for signposting, for self-help, for self-care, how the role fits into the mental health and legal system, which can often feel quite alien and difficult to navigate. And so we've really tried to provide a very comprehensive resource for nearest relatives who find themselves in this position and who need to find information quickly and be able to access it. And I think we've also tried to make sure that we've approached this in a way that's inclusive, that makes the resources accessible for people who might have particular needs. And you can see that we've also developed the kind of branding around it to make sure that that's also in calming colours for people who might have neurodiversity, for example, and needs in that area, to make sure that it's not too busy and too dense for people to navigate. So we've tried to put a lot of thought into how we've developed it in a way that's accessible and inclusive, and to make sure that it's available to people in a variety of different formats. If you just want to move on a little bit, Jeremy, I've just got a couple of other slides to talk you through here, and then I can hand you over to Kev. So what we've also got there is various bits of information that you can download. So for professionals who might be accessing the website, who might want to give information, we've developed leaflets for staff about the nearest relative role, and for other people who advise carers and family members. We've developed additional sources of tools, such as a complaints tool and tools around managing consent and confidentiality, because nearest relatives told us that those were areas that they often found quite difficult to navigate. And so we decided it would be quite useful to provide a little bit more information on how you might work your way through those kind of processes, which are often difficult to navigate. And I think one of those issues around consent and confidentiality came up a lot in terms of what information as a nearest relative you're entitled to, as distinct to being a carer, and what does the Mental Health Act provide in that area, because Jeremy's already said that, you know, you have a right to be informed or consulted about an admission, and it's important that you know what bits of information you are actually entitled to, and also to know which bits of information you can't have, and again that relates to patient consent. And then we've also developed some infographics which we thought might be quite useful just in terms of helping to navigate through the system, and that's an example up there of one of those downloadable tools that you can access on the website if you want to have a look at that. And then just finally, one other bit of information that we think is really important as well is nearest relatives who've worked with us have been very happy to share their experiences, and we're very fortunate that we've had such an amazing and committed group of nearest relatives who've all got caring experience, who've been able to work with us and share their experiences and time. And so we think it's really important as well for people who use the website to know that they're not alone and that they can access this information. So I'm just going to, I think, stop there, Jeremy, and hand over to Kev. I think, Kev, you're just going to talk a little bit through about how the resources can be used practically. But I think the most important thing for us is that it comes in lots of different shapes and sizes, that it's accessible, that it's available, freely available to anybody who needs it, as I said, in a mobile friendly option, and that it's available for different groups, in particular for nearest relatives and carers, for people who support them, for staff working in the mental health system, and as I said, for other people who support carers and families. So Kev, I'll hand over to you now, and then you can just pick up on that kind of practical impact, as well as what we're doing to change things when the nominated person role comes in. So thank you everybody for listening.
That's lovely. Thank you, Judy, and a lovely segue into these next few slides. So as Judy has explained, we produced a range of resources that we've produced, hopefully of really acceptable members, so who also need to have some information around a nearest relative role. So when nearest relatives are engaging with them, then that they've clearly got a very good understanding of that as well. But as others have alluded to, we know that change is on the horizon. We know that the nearest relative role is leaving us, and we're going to have the new nominated person role coming through in a couple of years' time. So we're busy preparing for the impact of that. But one of the key factors that Jeremy mentioned at the very beginning is around this idea of choice, and actually us being able to choose who our nominated person is moving forwards, rather than it being selected for us or having to go to court to make a change if we felt that was necessary. And so this choice agenda, which has been a thread all the way through current NHS policy, has now found itself embedded in our mental health legislation and through the nominated person. Both Judy and I have written blogs, and we put links there at the bottom, and maybe those links might go in the chat at some point as well. That might just give you a little bit more information around how we view the changes that are coming down the line in respect of the new nominated person role. But we're going to move on now just to thinking about what those changes are. So with this new change agenda, we will be able to choose our nominated person. There will be some age restrictions. So if you're 16 years or over, you will be able to nominate a person who is equally 16 years or over, which is a very interesting position for our legislation to take, because it kind of also, again, reaffirms this idea about almost when adulthood happens. You know, when are we able to make decisions for ourselves, and when are we able to kind of make those decisions than when we might previously had to been 18. However, if you are under 18, and sorry, if you're under 16, then your nominated person has to be 18 or above. But whoever we choose, they must be eligible. Okay, so they mustn't have been removed from a previous role by the court. They have to be deemed to be suitable to undertake that role, and must have capability and competence and capacity to be able to fulfill that role, and ultimately willing to do so. So there are some kind of restrictions which seem quite sensible, in the sense of us being able to choose somebody who can actually fulfill the role in a meaningful way. But there are considerations that we need to kind of consider. It's worth saying at this point as well that the code of practice, which always accompanies a Mental Health Act new piece of legislation, will probably do a lot of the heavy lifting in terms of explaining a lot of how we might go about choosing or supporting us in choosing that nominated person moving forward. So just watch that space. That will always be a free document produced by the government, but it's not available at the moment because it's being written, and so we await that arrival. Next slide, please, Jeremy. So broadly speaking, the new nominated person role will have an identical sets of rights and powers to our current nearest relative, with a few exceptions, and I will go through those. So as we look on the screen at the moment, we are minded that these are very key moments in a patient's life. So being admitted under Section 2 for assessment, which is for an important stage of the process to understand exactly what's going on for somebody, the nominated person will still have the right to be informed. So they'll need to be written to, phoned, contacted, whatever way, to explain that the person who's nominated them is being admitted to hospital, and that will continue, just as it does under the nearest relative function at the moment. Equally, for Section 3, which is for a treatment, up to 6 months, although it will be for 3 months of the new legislation, they will have the right to object or not to the person who's nominated them being admitted to hospital. So that power will still be there. They'll have the right to order discharge, as they do currently, for someone who's under Section 2 or 3, or under a community treatment order. So that's a framework that's put around somebody in the community if they've been on a section recently. And they'll continue to have the right to request that local services authorities make arrangements for an approved mental health professional to consider the patient's case with a view to making an application for admission to hospital. That's a bit of a mouthful, but basically what it means is we have a nominated person who's concerned that someone might need to go into hospital, and they want the local authority to assess them to make a decision as to whether that needs to happen or not. But we're going to have some extended powers. So at the moment, these powers don't exist, but they're going to moving forwards. So they'll have a right to object to a community treatment order as a nominated person. They have a right to be consulted about renewal. So somebody at the moment can have their Section 3 renewed without this consultation happening, but moving forwards, the nominated person will be able to be consulted. They have a right to be consulted about care and treatment plans, which I think is really important. I think one of the messages that we got through was around how nearest relatives at the moment are sometimes cut out of conversations because of confidentiality and GDPR and all those reasons that surround privacy. But moving forwards, nominated persons will have a right to be consulted around care and treatment plans. They also have a right to be consulted prior to a transfer, so between wards, and a right to a tribunal where a nominated person's objection, that's for a Section 3, is overwritten. Now, those are the new rights. I should have mentioned on the previous slide as well that even though somebody might be able to choose somebody now as a nominated person that isn't a family member, that doesn't mean that the approved mental health professional doesn't have to still consult to a degree with family members, because that is still in the legislation as well. So I think it's a point worth making. But those are the existing rights and those that are going to be extended. So worth to keep a note of those if you are going to be a nominated person moving forwards. Thank you. Next slide, please. So we are going to face scenarios where somebody has not nominated a person and they're likely to have to be admitted. If that's the case, then if there is a court-appointed donee or a deputy, as we can all choose if we want to have a lasting power of attorney, for instance, then the approved mental health professional must appoint them. We're still working out exactly who the approved mental health professional may appoint if the person hasn't nominated somebody. And again, a lot of that guidance will be in the code of practice, I'm sure. But what we do know is that the AMP, the approved mental health professional, must, in deciding who they're going to appoint, take into account the relevant patient's past and present wishes and feelings so far as reasonably ascertainable. So that is a really important message for AMPs to think about, what are those past and present wishes of that patient. The other part is, of course, is that there may be patients that we see, unfortunately, who are under the age of 18 years old. And then the nominated person will be selected from basically who has or has parental responsibility at that particular point. It might be the local authority. It might be that there's a court-appointed deputy involved. It will very much depend on the circumstances, but children and young people have been, really considered in this legislation in terms of who that nominated person is going to be. So that's probably everything I want to say. I'm really pleased that my network connection has lasted this long, which is really good. But I'm going to hand back now to Judy Martin. Or to Martin. Yeah, that's brilliant. And we put some references on the screen there as well, just so that if you want to read further and read deeper into what we've been doing, you can see where we've got our information from. Thank you very much for listening, and thank you for your patience.
Thanks very much to the three of you. Does that conclude your presentation?
It does, yeah. I'll stop sharing.
Thank you.
Yeah, pretty much. And just to say, we will be keeping the website updated. So we've got certain bits of information up there. So if you want to find out more as the information becomes available, we'll make sure we put it up on the website about that nominated person role. Because as Kev said, there's a lot of stuff that we don't know yet, a lot of known unknowns. So once they become known knowns, we'll make sure we update the website. So thank you very much. Diolch yn fawr iawn.
Thank you. Thanks to all three of you, and thanks for Kev for navigating his technical issues. As I said at the beginning, if anybody has any questions, if they use the Q&A button at the top of the screen, they can ask questions through me through that. But whilst people are perhaps having a think, I would probably use my chair's prerogative and I'll ask a question myself. I suppose, because it's not an area I'm that familiar with, I might be asking the obvious, but you talked all the way through about, sort of the emotional sort of toll of doing this and the burden of being the nearest relative. And I just wondered if there's a place for sort of formal or informal peer networks or some form of support for people, acknowledging, I guess, that this quite often happens in an emergency situation which can't be sort of pre-planned. I mean, do those sorts of networks exist? By the sound of your feedback, they didn't.
Should I go first and just mention the research, and then findings, and other people can come in with
I'll
what we
follow
offer.
you if you like.
So I think from the research findings indicated that there wasn't really support networks available to people. So I think, as you mentioned, that mental health fact assessments often happen in emergency situations. So people may get contacted for the first time and might not have an idea that they're a nearest relative until then. But quite often people may continue to be a nearest relative as people have subsequent admissions, and they may be involved in the sort of care and treatment plans. So people did say in some cases that the approved mental health professional who was doing the mental health fact assessment had rung them up and explained it to them and had tried to talk them through the process. Although largely people weren't very positive about the support that they'd been given. Really, there isn't a kind of distinct form of support there for people. There are some carers groups which are run by charities such as Rethink, for example, which are focused on carers more generally, but not specifically, people who are nearest relatives. Over to you, Judy.
Yeah, no, I mean, you just mentioned something I was going to mention, really. So I think basically there's a network of support groups for carers more generally, and a small part of that might be thinking about how there's that intersection with the mental health system and what support's needed. But I think specifically for this area, there's very little information there designed around the Mental Health Act and this particular role. It's something that the independent review, I think, into the Mental Health Act suggested we needed, recovery colleges, and we needed sort of potentially, advocacy, a role of support for somebody. But I think the role of peer support is crucial. And I know at various forums and groups that I've been speaking at, particularly there was a Black mental health carers forum in London I attended, and they really do draw a lot on that peer support and experience and sharing with others. But this is not a small number of people we're talking about. I mean, the latest sort of data on mental health admissions under the Mental Health Act for 2024-25, there were 52,731 new detentions under the Mental Health Act. So in theory, there are that number of mental health, nearest relatives out there or thereabouts. And so, there's quite a lot of people out there who are fulfilling this role. And I think, if we can try and bring those people together and feel at least that there's an online community where there's support and advice, then hopefully that is filling a bit of a gap. But I think you're right about the value and importance of peer support here. And that's really informed a lot of the design of the resources that we've developed based on people telling us what worked for them, what were the challenges, what were the areas that they would value that advice. But sadly, there's nothing formal in place. And I think we're going to be struggling to see the government coming forward with anything. I think funding is an issue. And so we perhaps won't see any particular support for people who are fulfilling this role. And that's really worrying, because this is an important safeguard. It's a statutory role that are given to people. Yet, you don't necessarily see the support that comes with that being forthcoming. So, yeah, I think anything we can do to spread the word about what information and support is there, at least online and for groups, is valuable. So hopefully that helps.
Brilliant. Thanks very much. There isn't any questions in the Q&A box, so I think we'll take that as that your presentation's been really thorough and you've answered everybody's questions. So unless anybody's got a burning question that they quickly want to put in the Q&A box now, I think
while you're waiting, Mark, I think just to mention that Craig Jacob has put in the chat, he's usually put the Cardiff Council funds targeted support for unpaid carers, specifically for those who are caring for someone with a mental health condition. So he's provided a link to the resource for Cardiff, but also identifies that there's other local authorities that provide similar services.
Brilliant. Thanks for picking that up.
Yeah, and I think just worth noting as well, I mean, obviously this is a seminar in Wales, you know, and there are differences as well in terms of what might be provided in Wales and England as well. And I think there's also differences as well around the code of practice in England and Wales that, you know, we need to think about. And we've been very mindful of that. And I'll just add, I hadn't mentioned this, and I can't believe I haven't, being a Welsh speaker, but one of the bits of work that we are doing with updating the website is to make sure that we have resources available in Welsh that are downloadable. So we are translating resources to make sure that that information is there and accessible in Wales as well. So yeah, I just want to champion that point before I finish, if that's okay.
Yeah, of course. Yeah, no, fantastic. Thanks very much. Right. So just to say they've just popped a poll into the chat. If people can complete that, that would be really helpful. But I think at this point, I'll thank our three speakers again for a really interesting presentation. As I say, one that I wasn't particularly that aware of, so I found it really interesting, and hopefully everybody else on the call has as well. As I said at the beginning, we'll make the recording available and the slides in the next few weeks. And thank you all for joining, and I hope you have a good rest of your day. Thanks very much.
Thank you, and thanks for hosting us today as well and inviting us to present.
No worries at all. Thank you.
Thanks very much.
Thanks all.